Hi everyone, I am Gauri PS, lecturer, Department of Radiography, Global College of Allied Sciences. Today we are going to discuss about the topic cerebral angiography. So what is cerebral angiography? The cerebral angiography is a medical imaging technique that is a procedure that is used to visualize the blood vessels which are found in the brain. It helps us to detect the problems like aneurysm, blockages, tumor, or bleeding in the brain blood supply. Actually, this angiography method are administered only under the guidance of the people or as a team, that is an interventional radiologist, anesthetic, cardiologist, radiological technologist, physician, nursing assistant. In the cerebral angiography, we will be imaging the intracranial arteries, and there will be catheterization, that is the insertion of the catheter in the selected vessels. That is, to visualize the vessels, we will be inserting this catheter into the specific vessel for the contrast administration. So, the common method which we use to this is called as Seldinger technique. It was developed by the Dr. Seldinger, and the vessels which is common for the catheterization are femoral artery, brachial artery, axillary artery, and radial artery. In the case of this cerebral angiography, we will be studying the blood vessels in the body by injecting the contrast media through the particular arteries and veins. So that is called as angiography. That is, cerebral angiography is a procedure that uses the contrast media and CT equipment to see the blood flow of the brain, and helps us to diagnose the brain's pathology. And this is a minimally invasive procedure. So next we will be looking about the cerebral. So this is cerebral angiography. That is the first we can look about the internal carotid artery, external carotid artery, and the tip of the catheter, common carotid artery, and the site of entry of the catheter. The site of the entry of the catheter is the where we will be inserting the catheter. That is, we are using is the femoral artery, and it will be in the groin, that is in the upper thigh region. So uh, so in the procedure, the tip of the catheter will be guided through the arteries and into the common carotid artery, and there we will be injecting the dye, and the X-ray images will be taken continuously. So next we will be looking about the indications. What are the indications which has to be followed? The indications will be to diagnose aneurysm, arteriovenous malformation, stenosis, blood clots, brain tumor with blood supply, stroke causes, and brain hemorrhages. So what are the things we should be do? That is in contraindication. So what is contraindication? That is, it should not be taken. So the contraindications are pregnancy, unstable vital signs, allergic patient, kidney problem, severe diabetics, hepatic failure, patient's delayed consent. So this all cases we will not be doing this cerebral angiography. So what are the things we should look before the cerebral angiogram? That is, we have to review the medical. That is, we have to review the patient's health conditions, medications, or allergy. That is due to the insertion of the coordinated contrast. Then 4 to 6 hours of fasting before the scan. Then should require that whether the kidney function is proper, and should remove all the metallic objects from the patient's body, and should explain the procedure and ensure that the patient is comfortable, etc. So the patient preparation is that we will be advising the patient to be of 6 to 8 hours of fasting, and the consent form will be signed by the patient or by the attender before starting of a procedure, and the allergic reactions we already checked, and the IV line will also be inserted, that is for the insertion of medicines. So next we will be looking about the technique. So what is the technique we follow? The technique is that the patient will be lying in the angiographic table. So, and we will be injecting a local anesthesia. Why do we use local anesthesia? That is to numb the area. There is a femoral artery. And next we will be using a small catheter that will be inserted into the artery under the fluoroscopic guidance to the blood vessels in the groin. And the iodinated contrast dye will be injected to highlight the blood vessels. These are brain's blood vessels. When the injection of this contrast, we will be feeling a warm sensation or sometimes a metallic taste. This is all common. And then the scanner will be capturing the high resolution images of the brain, arteries and veins, and will be asked to stay still and hold the breath briefly for the image clarity. And it's a painless technique. It's also quickly and it mostly takes 10 to 15 minutes. And the technologist will be stays in contact and will be monitoring us throughout. So, next is about the complications or post-procedure care. So, what is the post-procedure care? So, the post-procedure care here means that the patient should be in a bed rest. It should not be stand still. So, bed rest is compulsory, and you have to keep the puncture part without moving for at least 6 to 8 hours. And you should watch for any recurrences of bleeding. Peripheral pulses should be monitored. That is, vital should be monitored continuously, and patient should be hydrated, and deterioration of the renal function should be watched, and patient should be taken care properly. So here some of the complications may occur. So what is the complications? The complications means bleeding, stroke, or sometimes allergic reactions to the contrast administration. So it is necessary to take the care of the patient during the cerebral angiography. So that's all for today's class. Thank you.